Alright, here we are, the last learning plan. We're covering Chapter 12, Ethical Issues in Group Work. So there's lots of things to consider in this particular chapter. When we're discussing group work, we're talking about usually some type of group process where there are clients, maybe anywhere from 4 up to 8 or 12, and then you have a facilitator who facilitates the group or leads the group discussion. A lot of times in the world that I come from, groups have curriculum that's used, and that curriculum is research-based and validated as cognitive behavioral in nature. So there are some things to talk about in terms of ethical issues in group work. And one of the things that a facilitator has to be able to do is to work independently and be able to communicate with his or her supervisor regarding the group process and any issues that arise. A lot of times individual group members will use the group as a way to vent about issues that may not pertain to why they are there. For instance, we have alcohol and substance abuse groups that run, and we have a group called Thinking for a Change that runs, and occasionally clients will like to use those type of groups to discuss their agents, their case managers, and usually not in a positive light. So in order for the group process to work effectively, everyone needs to stay on track, and in order to do that, the facilitator has to be very good at redirecting clients to stay focused, because what can quickly happen is things can spiral out of control, and next thing you know, everyone's kind of complaining about things that have no relevancy to the group. There's a reason why that happens, a couple reasons. Probably the most important is that those type of people don't want to focus on their own issues, and so anywhere they can place the blame or anywhere they can distract the group works out for their benefit. So it takes a strong person to be able to come in and facilitate a group and keep the group focused and on track, because otherwise you could have some issues with that. All right. We look at how group is run and ethical issues in that aspect. The group is typically used for people to give each other feedback based on whatever the topic of discussion is. Sometimes clients will try to use that as a way to focus solely on themselves, which is okay for intermittently, but to use it all the time in that fashion can really drain the group, and it's not effective and can cause some issues with other groups. So it's important that the facilitator kind of can be able to read the group as well and see if one person is sharing too much and people are starting to tune out, how to redirect that. The other thing to consider is it's not enough to just lecture in a group. A facilitator's job is to lead a discussion, so not necessarily, you're not really a teacher standing up in front of a classroom giving a lecture. You're posing a question, or you're going through some curriculum, and the group is expected to participate. Typically in cognitive behavioral type groups, we do a lot of role-playing activities, a lot of experiential type of group activity. And so that's important, because that's going to help solidify any new concepts that we're introducing, and it's going to help clients kind of do some self-exploration. Now, supervision is a key component in training group leaders. So group facilitators need to be supervised just like anyone else. And supervisors should observe groups that their facilitators are leading as well. And I try to do that as much as I'm able to. But it just helps kind of keep things in order. All right. The other major ethical issue that you want to keep in mind when it comes to group work is I shouldn't say a lot of times, but sometimes we have facilitators and sometimes the less experienced facilitators that want to use the group for their own sounding board. So you'll have facilitators that want to discuss their own personal life, or if a client brings up a situation that he or she is struggling with, the counselor may try and relate to that client and then discuss a similar incident or situation in his or her own life. And this can be very distracting for the group. It can be very counterproductive. Typically a facilitator's job, like I said before, is to lead a discussion, but not necessarily discuss his or her own experiences. There is a time and place for that, and I think that it's okay to be able to discuss or disclose some information about your own personal life as it relates to the curriculum, but less is more when it comes to group work as a facilitator, because the group can just get way too easily distracted and the focus can become all about you as a facilitator versus them as the group participants, which is what some of them want. They want to try and avoid discussing any of their own issues and trying to work on anything they may need to work on. So, and I've seen it happen before where group facilitators will take the group completely off track because they focus on their own personal issues, and that can be, a huge boundary issue as well. So it's something to keep aware of when you're working with groups, that you want to make sure that you are given, if you choose to disclose about your own personal life, that you do it in a very very tasteful manner, meaning you don't give out too much information and you want to kind of be general with the information you do provide. Some group members are curious about your own personal experiences because it sometimes can benefit them if they have something that they can learn from it. But typically they want to use that as a scapegoat to try and take the focus off of themselves. All right, and then another thing to consider too is the cultural makeup of your group as well. You're typically not going to have one type of background in your group or culture. You're going to have various cultures, and so it's important to understand the culture. For instance, we have several among clients that attend group services with us, and so that culture is male dominated, and they typically don't feel comfortable opening up in a group setting with other males unless the group is led by a male counselor or facilitator. So it can be a little difficult to kind of help them open up a little bit unless kind of the right variables are in place. So we have to recognize those and work with them as much as we can. Sometimes we can accommodate cultural differences and try and work within those parameters, and sometimes we can't. But it's important that we at least recognize them and try and work through those as much as possible and help. The goal, of course, is to help the client, and so if there are roadblocks or challenges in the way, we want to try and reduce those as much as possible. All right. In your book on page 438, there are some ethical guidelines for acquiring diversity competence in group practice. So you can take a look at those as well as you're going through the chapter. Some case studies. We're talking about co-leadership, co-leading a group, and that typically happens with groups where, like a cognitive behavioral type group, like we have a thinking for a change group, and we have what's called a reasoning and rehabilitation group. Those groups use co-facilitators at times, or they can be used with co-facilitators. Some issues that are posed with using co-facilitators is how do you determine who is going to lead and who's going to be the co-leader, and who is going to prepare the majority of the material, and who, how are the tasks going to be divided. It's important that that is discussed with the supervisor. And that's discussed with the two facilitators as well. It helps the clients too, because now you have two people in there that can kind of help facilitate conversations and work through differences and whatnot. All right, we've discussed informed consent, so everyone should be aware of what informed consent is. You know, even though I'll talk about involuntary participation, even though all of our clients that come to us are involuntary, we still have to give them informed consents, because, I mean, technically under the law they do have the right to find other resources to, you know, or treatment providers if they want. But typically their probation or parole agent will refer them to us, and it's because of either a probation parole violation, or they've just been assigned to an agent, newly convicted, and they present with some AODA issues or other issues that need to be addressed right away. So we'll receive the referral, and you know, it can be challenging working with people who don't want to be there, especially in a group setting. However, what we found is that if the facilitator is open and non-judgmental and attempts to build a positive rapport, 9 times out of 10, those clients are going to respond positively in some way, shape, or form. They may not perform the best, or may not be engaged in treatment all the way, but at least what our goal is to at least get them open enough to start looking at some things within themselves. So there are some considerations that you want to take a look at when working with involuntary participation. And that's actually on page 446 in your book as well. So, you know, some things to consider. Are people allowed to leave the group if they're involuntary, if they have to participate, they're forced to participate? And the answer is yes. I mean, we can't stop people from getting up out of group and leaving if they feel uncomfortable or if they're upset. You know, they certainly have the freedom to do that. We always make sure they understand, though, that when they leave the group without permission, that there could be consequences, and not necessarily from us, but from their agent. And so we have to make sure we convey or communicate all of the possible consequences, both negative and positive for participation. Negative as well. We weigh both pros and cons for participating and pros and cons for not participating. So then that way the client is empowered, they feel they have some autonomy, they can make their own decision. And there's lots of research out there to support group work. It's a huge benefit for clients. A lot of change happens, or at least a change process occurs during group process time, and so they can really be powerful tools that we use. And just like any powerful tool, they can be abused as well. So it's important that we really understand what our role is as a facilitator or helper is in a group setting, and understand that the group process is bigger than we are, and it's actually the clients that help each other more so than what we do or what we contribute to the group. But we are there to provide structure and discussion topics and model different behaviors. All right, so I think I'm going to leave chapter 12 here. Make sure you read through it all. If you have any questions, let me know, and we'll see you in chapter 13.